For many years, there has been concern in the autism community about the use of acetaminophen due to its potential impact on glutathione, which is an important protein that we make that's responsible for detoxification and for lowering inflammation. The US government has now put out a warning about this potential concern. So let's talk about it. Hey, everybody, I'm Dr. David Berger, a board certified pediatrician in Tampa, Florida. In my practice, I've always had concerns about the use of acetaminophen, and I have recommended alternatives when possible. Now, due to concerns during pregnancy, however, there are also concerns about other options such as ibuprofen. So those options overall are more limited in the pregnancy population. However, there may be a subpopulation of women who do not make well or do not reproduce well a protein called glutathione. It's a small peptide which is needed for detoxification as well as for lowering inflammation. So today we're going to talk about this. We're going to talk about the use of N-acetylcysteine, which may be able to combat some of the issues that concerns in the first place, but also a hypothesis. Might there be a subpopulation who are at risk for lower glutathione production due to their genetics, who then may have a compounded risk when acetaminophen is being used? Now, to be clear, the recommendation from the government is actually what I have been saying in terms of being absolutely judicious, lowest dose, shortest period of time. However, it's also clear that while a warning has come out, there is no new research really that has been done that changes around what's been known. And medical societies are still recommending the use of acetaminophen when needed during pregnancy. Now, let's first, though, talk about what fever is, because the recommendation from the government is to use it only if there's a significant fever. Now, fever itself is a 100.4 or higher temperature, and not all fevers need to be treated. In fact, in non-pregnancy states, when I'm in the pediatric population, fever is good. Fever actually helps reduce the length of time a person's sick. It's part of the immune response. Our body does it for a reason. Now, I recommend you treat the child, don't treat the temperature. If a kid is comfortable, but the temperature is higher, let it be. If a kid is miserable, then consider it as a misery treater, not as a number treater. Now, a lower grade fever is under 101 degrees. And for that, it is okay to watch how things are going, to rest, well hydrate, chill. Now, a temperature over 101, though, especially if it's persistent, which is greater for a day or keeps on coming back through the day, or if there's chills, aches, fevers, types of thing, that's a little bit more of a concerning and where lowering the fever may be a recommended thing to do. But in addition, if a temperature is over 102 degrees, that's something that probably does need to be treated right away. High fevers themselves can cause problems during pregnancy. Now, again, you'd want to use it as low as possible. Stop it as soon as the fever and the symptoms go back, but as judicious as possible. You have to find a balance in each person's individual. And of course, consult with your healthcare provider on this. Now, what does the research actually show relative to autism? Now, the largest study that was done looked at 2.5 million births, and they did not find a causal link once family factors were controlled, i.e. looking at siblings. Of course, if this was an issue that was relative specifically to pregnancy, and it was used during both pregnancies or more than one pregnancy, then the issue should be there for both. And that's where the research has fallen short in the biggest of all the research. But there have also been meta-analyses, which are studies that actually combine multiple other studies together to come up with broader conclusions. And there was some small increased risk for both autism and ADHD discovered. However, when they looked at these systemic reviews, not all studies showed it. Some showed that there was the association with autism and acetaminophen. Others did not. There was more evidence actually with ADHD. But again, all of these were observational. These were reports by the families looking at chart reviews. This wasn't any kind of placebo-controlled, type of research in order that most time these types of recommendations are based on. But, is it a concern based upon what's out there? There is concerns. It's just by no way has this been proven to be a problem. Now, the reason why, and as I mentioned, why we think this could be a problem, or at least the biological plausibility, is relative to glutathione. Now, glutathione, again, as I said, it's really important for detoxification, really important for keeping inflammation under control. And glutathione is needed But there's a metabolite of acetaminophen. It's called NAPQI, and that metabolite actually consumes glutathione. It lowers the glutathione levels in the body, and when the glutathione is reserved, is reduced. Something called oxidative stress, free radical damage at the cellular level, can occur. Now, in addition to that, the glutathione itself, when it's lowered, it's an important antioxidant that it buffers worsening inflammatory signaling. So it helps keep inflammation under control, because inflammation, as we learned through cytokine storms, etc., that's also problematic. But it also does not seem to be strictly based on glutathione, because acetaminophen itself may alter the immune function. So also relative to autism, and this is where it kind of ties together, many children with autism do show higher oxidative stress markers. They show lower glutathione levels, and they also have signs of immune activation in both brain and blood tissue. So glutathione is an essential substance, and it does have immune disrupting and so that's why this is a plausible concern. Now, in terms of genetics, we've talked before about MTHFR, the gene that activates folate from turning folate to methylfolate. Now, this actually is very important for the production of glutathione. And there is research that shows that people who have MTHFR, especially a double homozygous C677T mutation, lowers the production of glutathione in the first place. Now, also, there are certain genetic variants that can make weaker the conversion of N-acetylcysteine, or NAC, which is needed to make glutathione. There's also other genetics that can decrease the recirculation of what's called oxidized glutathione. This is the used form, the no longer active form, back to reduced glutathione, which is the active form. It's a recycling phenomenon. And again, there's genes coding for enzymes that need to make that happen, and they could have variants as well. Now, pregnancy itself also does lower antioxidant reserves. And so could there again be a combination of all of these things put together? So this is the hypothesis. Is there a subset of the population that may have this genetic this preconditioning, if you will, that when bringing in the acetaminophen in combination could lower glutathione too much? I really hope there's research done to see if this is so. Now, N-acetylcysteine itself, NAC. So, as I said, is needed to produce the glutathione, but it also directly binds to that NAPQI. So it helps reduce that acetaminophen metabolite that is the problem in the first place. Now, it's actually used for overdose conditions even during pregnancy. If someone has an acetaminophen overdose, this is what's given in hospitals. And there has been quite a bit of safety data that shows that it is safe to use during pregnancy. It's considered a category B. So if N-acetylcysteine, which is needed to restore glutathione, then that could potentially be helpful. And because it is approved as for use in pregnancy, even if you look in the textbooks, oral doses of 600 to 1200 milligrams of glutathione per day has been studied and found to be safe in pregnancy trials. And again, in an overdose situation, they'll give it intravenously. So this may be an option for people to take if they have to use acetaminophen to combat whatever issues that the acetaminophen might be causing. Now, in addition to that, there may be one more problem, though, because some people do not convert N-acetylcysteine to glutathione efficiently due to other genetic factors. Okay, so there is a form of glutathione that I use in my practice widely called Cetria glutathione, and that has been shown to increase both the blood and intracellular levels of glutathione in research that was done at Penn State University and others. So this might be another alternative for people who have that conversion problem, but it has not been studied as well as with N-acetylcysteine. So, that's something to look forward to, and I think maybe in judicious situations, especially if a genetic panel of these single nucleotide polymorphisms, or SNPs, such as MTHFR, such as the glutathione production, maybe there's a role for this as well. So overall, I look forward to more research being done. A lot more needs to be done. This is an open topic. I think that bringing it forth, because this is coming up, I think as a warning to say, hey, this might be a problem. I think that it's that, but again, there is not proof of this. These are associations. Unfortunately, a lot of times people will take things to the next level and say it should be banned for use and all of these things, and we're not there. And again, it may be the only alternatives out there. And would I recommend it to patient if those criteria were met where it's judiciously needed? Yeah, I would. So, anyways, really, this is not about fear. This is about education. This is about understanding, about making the best decision for you. Have a nice day.